Madam Speaker, I rise to ask question 14 of 2018 under my name. The question is directed to the Honourable Minister for Health and Medical Services. The question is, in line with the changes in climate patterns, can the Minister inform the House as to the challenges faced by the Ministry in food and nutrition security? Thank you.
Thank you, Minister for Health and Medical Services. Thank you, Madam Speaker. Madam Speaker, I thank the Honourable Member for the question. Please allow me a couple of minutes to give a background information regarding the question that has been posed by the Honourable Member. Madam Speaker, we are all aware that climate change is real, climate change is here, and climate change is affecting people across the globe, including our Pacific Islands. Climate change exacerbates the risk of hunger and undernutrition through 6 of these elements. Extreme weather events increases the frequency and intensity of some disasters, such as drought, floods and storms. And recently, T.C. Winston wreaked havoc in Fiji, and of course, we've also had the impacts of Cyclone Gita experienced by our people. This has an adverse impact on livelihoods and food security. Climate-related disasters have the potential to destroy crops, critical infrastructure, key community assets, therefore deteriorating livelihoods and exacerbating poverty. Madam Speaker, sea level will rise as a result of climate change, affecting again livelihoods of our coastal communities and river deltas. In terms of food security, Madam Speaker, climate change affects all dimensions of food security and nutrition. Food availability, changes in climatic conditions have already affected the production of some staple crops, and future climate changes threatens to exacerbate this. Higher temperatures will have an impact on yields, while changes in rainfall could affect both crop quality and quantity. Food excess. Climate change could increase the prices of major crops in some regions, including ours. For the most vulnerable people, lower agricultural output means lower incomes. Under these conditions, the poorest people, who already use most of their income on food, sacrifice additional income and assets to meet their nutritional requirements, or resort to poor coping strategies. Food utilization, Madam Speaker, climate-related risks affect calorie intake, particularly in areas where chronic food insecurity is already a significant problem. Changing climatic conditions could also create a vicious cycle of diseases and hunger. Nutrition, thus, is likely to be affected by climate change through related impacts on food security, dietary diversity, care practices and health, and finally, Madam Speaker, food stability. The climatic variability produced by more frequent and intense weather events can upset the stability of individuals and government food security strategies, creating fluctuations in food availability, access and utilization. Madam Speaker, if I go back to the question, I will be able to address the second part of the question that is looking at nutrition, and I believe my colleague, Minister of Agriculture, would be in a better position to advise the House on food security. As we've noted, Madam Speaker, there is overwhelming science available that climate is changing. In terms of our Fiji situation, in terms of food and nutrition security, there are some key challenges that we, like any other developing nations, are facing and expect these challenges to grow as we continue to feel the extremities of climate change. Mainly, for us, the burden of malnutrition, underweight, overweight, and micronutrition deficiencies exist. Unfortunately, Madam Speaker, this is commonly occurring in same households, with the most vulnerable affecting children and elderly. In our last National Nutrition Survey in 2016, it was revealed that almost half of our population is estimated to have anemia. That's like 41.6%, and that's very alarming. On the other hand, there's also issues of non-communicable diseases, particularly with the issues of overweight and obesity in children. Madam Speaker, climate change, as I said, affects our food production. It affects our nutrition security capacity, which in turn increases our dependency on imported foods and processed foods, and also becomes a huge contributing factor to the escalating levels of NCDs. For instance, according to the same National Nutrition Survey in 2016, 4.8% under 5-year-olds, 7.2% within 15 to 17-year-olds, 8.1% within 15 to 17-year-olds are found to be overweight. Our statistics also reveal that 31.4% of our adult population are overweight, while 31.7% are obese. This means more than half of Fiji's population is at a higher risk of suffering from some form of non-communicable diseases such as diabetes, hypertension, cardiac diseases and cancers. Apart from this, the survey has also showed micronutrient deficiencies in women of childbearing age, with 19.7% having iron deficiency, 8.5% with folate deficiency, 18.3% with vitamin deficiency, and vitamin A deficiency, and 19 having zinc deficiency. Micronutrient deficiencies in women often results in compromised status for newborns and problems associated with maternal and childhood. Madam Speaker, all in all, nutrition security, yes, is indeed a challenge for the ministry and the government as a whole. That's why we are taking a whole-of-government approach. And I'd like to advise the House that the Ministry of Health and Medical Services doesn't walk alone. It works with other agencies like the Ministry of Agriculture, Ministry of Education, Ministry of Women, Youth and Sports and Ethiopian Affairs. We also have the academic institutions of UNC and FNU, and international and regional organizations such as WHO, the UNICEF, Food and Agriculture Organization, where we try to work together in a very collaborative form and find out solutions. Based on that, we have developed our Policy on Food and Nutrition Security 2018 and the Fiji Plan of Action for Food and Nutrition Security 2018-22. And these documents are aligned to the Ministry's National Strategic Plan and of course the 5-year and the 20-year National Development Plan for Fijians. And this will be later submitted to Cabinet by the Honourable Minister for Agriculture. Madam Speaker, before I allow for supplementary questions, it's very important to watch what we eat. That's the underlying challenge that we are facing. It's very difficult to change mindsets of people as to what to eat. We all eat, but being more aware of the nutritional value of foods, the type of food, the amount of food, the timing of our food intake is very important. And I think each one of us should be the ambassadors for our local communities or our groups and talk to people about the need to rely more on locally grown fresh fruits and vegetables. I'm sure in the morning we talked about bread and why the price of bread has gone up. I'm sure you're going to talk about butter, why the price of butter has gone up. I'm sure very shortly we'll talk about lamb chops, why the price of lamb chops, and many more. I mean, totally understand. But Madam Speaker, we need to be champions of healthy living ourselves. I think we need to start off. We need to start off by looking at our plates, own plates during our tea break, our lunch break, our afternoon break, and let's start off. Let's start off. You know, the charity begins at home. So before we can actually get our people to get into the habit of eating healthy foods, we need to be champions of that. Let's avoid obesity and being overweight. Let's eat and promote the 3 main food groups that our primary school teachers teach us. Let's feed our children with healthy fruits and vegetables. Let's promote more green leafy vegetables, bale, sage, and things that is best grown in our climatic conditions here. And we've launched a MyKana app for the information of the House. Through the Food and Nutrition Center last year, we launched a mobile application app called MyKana, which is a user-friendly software designed in Fiji for Fijians, and it promotes healthy eating. It allows us to record and visualize our meals and monitor whether our daily meals are nutritious, balanced, or healthy. Having this app is similar to having a personal dietitian at home who's going to guide you to healthier lifestyle. So if you don't have that app, please download MyKana app from Google Store right away. And that applies to all of you. We have had 4,000 people already downloading this application, but we'd like more Fijians to download that because it definitely works in promoting healthy lifestyle. Thank you, Madam Speaker.